Myself, Sushil, Dr. Sushil Upadhyay from India. It is quite late night here. It's 11 p.m. I am feeling very much grateful to the organizing team for giving me opportunity to present my review type of work on the topic, the concept and scopes of nanotechnology in combating COVID-19. The outbreak of COVID-19 begins in Wuhan, China. Coronavirus is the global crisis posing unprecedented difficulties to human beings and great human losses and deep socioeconomic damage. It was more prone to the pupils which are immunocompromised and showed a greater lethality in terms of the death, like 10.5%, and with cardiovascular arrest, it is about 52%. These are several hazardous to hazardous variants of COVID-19 which affect the global scenario which we feel in last 2 years, and it is still continued right now as well. So in the name of health as our primary necessity, the common interest should be addressed in the future. Keeping in mind the One Health concept, relying on the belief, well-being, human strength, men, animals, and environment. To tackle these complex challenges, the collaboration between multiple scientific groups is necessary, and so we are here in position to work with nanotechnologists to diagnose and try to cure or combat the effect of SARS-CoV or COVID-19. The promising exchange, increasing diversity in teams will be necessary to obtain new impact by scientific solutions. From this, we are in position to nanotechnology is required to lay new foundation towards combating recent global public health threat and rethinking a more sustainable future based on science. So what are the nanoparticles? We have discussed in a large number of the talks about the nanoparticles, which are very tiny molecules, very small, but have large surface area in comparison to the volume, giving them this unprecedented unique features. That's why it is applied in various scopes in combating several diseases, and especially keeping in mind and their effective roles in HIVs and several other virus-borne diseases like adenovirus-borne diseases. Therefore, it is also included in SARS-CoV-2. The nanostrategy antiviral drug delivery and efficiency individually in combination with nucleoside analogs. There are several available nanodelivery systems can be used with newly developed drug formulations to efficiently deliver drugs with rapid therapeutic potential. The nanotechnology can be applied in the early diagnosis of SARS-CoV-2 responsible for COVID-19, and prior to the nanotechnological diagnosis, the other tools applied like CT scanning, RT-PCR, which having very proficient diagnostic techniques. But when we applied for the nanotechnological particles using this technique, then the electromagnetic properties of nanoparticles are helpful for easy and swift diagnosis of the infection. So the nanoparticles used for the diagnosis, early diagnosis of COVID-19 were based upon its magnetic properties, which were because of the hybridization potential with the electromagnetic substances. Among these, the gold nanoparticles, silver nanoparticles hybridization is very much efficient, and it helpful in the electrochemical hybridization assay for early diagnosis of COVID-19. The second is especially the gold nanoparticles, These gold nanoparticles are used because of its simplicity, electrostatic surface design, and moieties. It is creating a sandwich between antigens and antibodies so that the bonds-based colorimetric assay were designed the application and the early diagnosis of COVID-19 or SARS-CoV-2 infection among COVID patients. AU nanoparticle-based elementary hybridization assay was accounted for utilizing a DNA probe, which comprises a thiolated DNA comb consequences of this basis for phosphate stabilization. And it is the anode-based surface metallic ion, a silver ion can stem and eliminated in proportion to concentration of alkaline phosphate. That's why it is used for early diagnosis. The chiral gold nanoparticles with quantum dots have recently utilized to build star-shaped chiroplasmic silver nanoparticles that can be detect distinctive viral infections, including SARS-CoV-2 or COVID-19. These are several nanoparticle-based diagnostic tools were applied based upon the magnetic nanoparticles and gold nanoparticles. The current strategies to combat the recent pandemics based upon reverse transcriptase loop-mediated, point-of-care, optical biosensor, nanopore target sequencing, etc. Among these, the point-of-care testing system is followed when the patient samples are not sent to the research facilities. This method does not require lab network to recognize patients who are infected. Lateral flow antigen detection for SARS-CoV-2 in consideration is best for point being used during the DNA diagnosis. However, in optical biosensor nanotechnologies, the patient's sample were used for detection or diagnosis of infection based upon optical biosensor. In this case, the diagnosis were done within 30 minutes, and this method is conceivably be utilized for procurement of patients and dealing with current pandemic situation. So these are the best tools utilized for early diagnosis. The mechanism of action includes principal investigations indicated that the nanoparticles reaction induce antiviral activity. Nanomaterials that works indirectly does not restrain virus alone, rather they enhance the pharmacological actions of the antiviral medicines and utilize the better stability and bioavailability. Interestingly, nanoparticles with direct activity acts as a compound since they resist the viral infection alone. And based upon the literature survey, Lara et al. 2005 have reported that the receptors for antiviral drugs, especially with the silver nanoparticles restraining the infectivity, keeping in points these kinds of nano particle-based diagnostic tools were applied for early diagnosis and early cure of SARS-CoV-2. Even though the several vaccines are available right now in India and across the world for combating the COVID-19, but the application of nanoparticles will be more prolonged and helpful in long-term diagnosis, detection, and curing of these kinds of disease. The nanovaccines were also developed according to the basis of antigen processing cells have ability to capturing microparticulate silver complex to boost adaptive autoimmune response that subsists with pathogen after entering inside an organism. VLP could be a leading approach for development of safer nanovaccine. The recombinant vaccine based upon VLP against hepatitis B virus and human papillomavirus is very much commercialized. Henceforth, it is used for SARS-CoV-2 as well. So I wish to complete or summarized here. There are several tools and techniques are even though available for diagnosis, but the application of nanoparticles can enhance it multifold in early diagnosis and better cure system. So thank you so much, sir, for giving me opportunity to present my short review over this. It is a type of preliminary investigations and study that compiled by me on person basis based upon the literature survey. So thank you so much, sir.
Thank you, Dr. Sushil, for your presentation. Does anyone have questions on his talk?